Hi, I'm Dr. Dan Shapiro. I'm plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing in the Scottsdale Paradise Valley area since 1992, and that's all I do. I just perform cosmetic or aesthetic plastic surgery. I do a lot of facial surgery and questions that sometimes people ask, when they come in and they can't decide whether or not I should do this, should I have surgery? People often ask, Dr. Shapiro, should I have this facial procedure before I need it? And the answer to the question is, I don't know. And it really depends upon the person. I say across the board, I usually don't prescribe, you having surgery before you quote unquote need it. So basically, I don't really believe in proactive cosmetic surgery. That is where non-invasive treatments really come in. Let's say you feel as though that your mom or your sister has some brow descent and you really want to nip that in the bud and get a brow lift. Well, I don't think that's the best thing because, every surgical procedure has risks and complications, and there's no real reason of subjecting yourself to elective cosmetic surgery before you need it because that's unnecessary risk. And that is where some of the non-invasive treatments come in. I wholly endorse non-invasive treatments for younger patients or patients that can't decide whether or not they're ready for a particular procedure. And for the face, there are so many non-invasive procedures out there that are wonderful. With regards to wrinkles, obviously there's Botox that can be very proactive. I think the longer they use Botox, the more it inactivates the muscle, and I think those wrinkles will smooth out in a more promising fashion over time. So that is being proactive. I can perform a brow lift with Botox, and that is basically really great for a younger person who's not ready for surgery. Obviously, if somebody needs a brow lift, surgery is probably a better way to go. Now, with regards to the lower face and around the eyes, oftentimes as we age, we will go ahead and lose volume, and basically we could do some non-invasive fillers. We can go ahead and use some fat transfer, and these are relatively non-invasive procedures that can be done in the office. There are also things, like I said, Juvederm, Restylane, there is Sculptra, many soft tissue fillers that will give you that volume that you're looking for without having a facelift. With regards to skin laxity and descent of some of the muscles and facial fat, there is a non-invasive procedure called Ulthera, which uses ultrasound to coagulate or tighten the deeper tissues. And really, in somebody who's younger, you can get a very nice result without having surgery. Now, if somebody needs a facelift, of course, the surgery is going to give you the better result. But I think that, if you're not ready for a facelift, then don't have a facelift. Also, with regards to some of the other procedures, these can be combined completely. So oftentimes, we will do Botox along with soft tissue fillers and Ulthera at the same sitting. So all in all, I don't think that you should have surgery before you're ready for it or before you need it. And everybody's needs are different. So if people, will describe what it is that's bothering them, and I think the best result can be by doing surgery, I will prescribe surgery. But obviously, if you're not there yet, you shouldn't have the surgery, and you should explore more non-invasive techniques. We do them all in the Shapiro aesthetic plastic surgery practice in the Paradise Valley Skin Clinic. So come in for a consultation, tell us exactly what's bothering you, and we'll get you up on a schedule here. Oftentimes people are on a maintenance schedule for some laser therapy, micro peels, micro laser peels, along with Botox and fillers and some of the non-invasive treatments like Ultherapy. So come in for a consultation, we'll see what you need. Thank you.